I'm Dr. Rifai from Morocco, and I will present this comparison between posterior elevation and epithelial mapping in detecting early keratoconus. Which one of those is better to detect keratoconus in the early stage? We will, to simplify, I will put a green light when there is no keratoconus. I will put a yellow light when it is a borderline cornea, and a red light when it is real keratoconus. Case number 1. We have in this case, in the anterior surface and sagittal map, we have some small irregularities, about 1.5 of irregularities, but the posterior elevation is still normal. Let's go to Bella-Ambroso display in the same eye, so you will see that there is no abnormality and the elevations are in the normal range. So in this topography, you have some small irregularities in anterior surface, normal posterior elevations in the BFS mode, and normal elevations in Bella-Ambroso display. There are some small abnormalities, but we cannot confirm that it is a keratoconus. So this is a borderline case, and we can think that this is only an anterior surface abnormalities or tear film abnormalities. But when we do the epithelial mapping, we see that there is a donut image that shows that there is a thinning of the epithelium in this apex, and it is a keratoconus now. And we can confirm that it is a keratoconus when we look to the other eye, to the fellow eye of the same patient, that is real and confirmed keratoconus. So in this case, we have seen normal elevation but abnormal epithelial mapping. Let's go to the case number 2. In this case, you have some abnormalities in anterior surface, small asymmetry. You have a small island, but the values are still normal. The value of the posterior elevation now, here, it is 10 microns. So it is a normal value. Let's go to Bella-Ambroso display, and we have in the same cornea normal posterior elevations, and all is normal in this eye. So you have small abnormalities, and we can think in this case that it is only problem of tear film. We have some small abnormalities of elevations, but they are still in the normal range. We have Bella-Ambroso display, which is normal. So we can think that it is maybe a normal cornea or a borderline cornea. But when we do the epithelial mapping and we look here in this area of steepening, we have a thinning. We have a small thinning that shows that it is a keratoconus, that it is an early keratoconus. And we can confirm and we know that it is really a keratoconus because the fellow eye is a confirmed keratoconus by the elevations and by pentacam. So here you have a supposed unilateral keratoconus, but in this supposed normal eye, we have a real keratoconus confirmed by epithelial mapping with normal elevations. Let's go to case number 3. In the case number 3, you have this small asymmetry. You have an asymmetry of 1.5, which is abnormal, but the posterior elevation is still normal. It's plus 3 microns. In this case, you have normal Bellin-Ambrosi display, and you have uh, some abnormalities in the topometric. You have IHD, which is red. So in this case, you have asymmetry in the anterior surface that can be that can come from abnormalities in the tear film. You have the normal posterior elevation. You have normal Bellin-Ambrosi display. So it is normal or borderline. It is a borderline case. But when we do the epithelial mapping, we see in this steep area that we have a thinning that confirms the keratoconus. Case number 4. We have here a cornea in normal values. You have the K max, which is 44. You have a small host spot here. We have an abnormality here, but there is a small island, but the elevation value of the thinnest location is normal. It is plus 8. So when we see this cornea, we have an asymmetry, but it is very small asymmetry. We have 0.7 asymmetry. We have a normal value of elevation. So we have a small hotspot, and we have a small island, but with normal values. So when we see this cornea, we say that it is normal, or maybe borderline. When you see Bellin-Ambrosi display, elevations in anterior and posterior surface are normal, and all these abnormalities that we have are coming from thickness. So when we look to elevation, here it is normal, here it is normal in Bellin-Ambrosi display, and topometric are normal. But so we can consider this cornea normal or borderline. But when we do the epithelial mapping, even if we have only small steepening here, but there is a thinning of it. So this thinning in the steepest area of the cornea shows that it is a keratoconus. It is an early keratoconus. So if this is the topography or the tomography, which shows small abnormalities, very small abnormality, but within the normal values. Bellin-Ambrosi within the normal values, but epithelial mapping shows that there is a problem, and there is an early keratoconus in this case. Let's discuss these 4 cases. We know now, after the works of Dan Reinstein, that epithelium is not homogeneous, and irregular stroma lead to irregular epithelium, and irregular epithelium discover irregular stroma. So when we find an irregular epithelium, we have to look for irregular stroma. So in this case, you have this small abnormalities in the anterior surface, but you have thinning over the steepest area. And this is the draw of Dan Reinstein that shows when you have small abnormalities on the anterior surface and you have a thinning over the steepest area, that it is a keratoconus. And in this draw, you can see that there is an abnormality in the anterior stroma and an abnormality in the posterior stroma, and there is an abnormality in the posterior elevation. But let's see this. In this keratoconic cornea, you have you can have this posterior elevation that is normal. This is a real case. You have abnormal normal posterior elevation, but you have an abnormal and a thinning in the epithelial mapping. Why? When we have a very early keratoconus, and when we use the BFS mode of elevations in the posterior surface, when the keratoconus is too small and too early, the reference surface is near to the anterior is near to the steepest and the flat the most flat area of the cornea. So the values of the elevations are too small and they are in the normal range. Also, if we use Bellin-Ambrosio display, even if it gives more enhanced part of the ectasia, but the values are still in the normal range. That's why the posterior elevation, when it is abnormal in the early cases of keratoconus, it cannot be detected neither by BFS mode or Bellin-Ambrosio display. But we know after the Reinstein works that there is a thinning of epithelium to mask any stromal protrusion. So in any or every steepening of the anterior stroma, we have a masking effect of the epithelium, and the epithelium measurement is very accurate with the spectral domain OCT, and we can measure by microns. So even when the thinning of the epithelium is very low, it is detected by the OCT, and it was shown in our four previous cases. So in the conclusion, as we have seen here, that in the early cases of keratoconus, we can maybe have normal elevations in BFS or in Bellin-Ambrosio, but the epithelial mapping will shows, and the epithelial mapping is more sensitive to steepening to the steepening of the cornea, and more sensitive to detect the early keratoconus cases, even if the posterior elevation is normal. Thank you very much. I'm waiting for your comments and your questions. Thank you very much.